Holly, how about over at Defense Healthcare? Give us an example of a program you'd like to highlight.
Well, when I started out talking about our electronic health record and really
Mhm.
that being the foundation, but it's really about how we're using that data. Uh, and so I'd like to highlight a couple areas where we're really pushing that data centric model. I really liked what Nick said about the modern data experience versus a modern system experience, like shifting from that system focus to that data centric model. And so we've looked at it from a registry perspective. For instance, when the pandemic kicked off, we had when our response, we're looking at how can we use the registry information we have to really start to track this long term. So our EATS team created this pandemic registry where we're able to track and pull in all the data that's happening in disparate places for lab testing and now vaccinations. And we'll be able to create that sort of longitudinal research and look at the COVID information. All of the work we've done in the platform space to the point of being able to say, making it work for you. We did all this background work leading up to, being able to have that cloud environment, being able to get things to where it needs to be, enabled us to actually be able to provide that data, to provide the data to the CDC when needed, to provide it to the states, to provide where we were in this in this response, this massive response where we had to have data really at our fingertips, right? It's sounds easy to say, oh, connect it all together, right? But we all know working in this industry, it's a lot harder to do than it is to say. And so really,
we're talking about here.
Yeah. So it's getting that in the hands of the people that need it. And so from COVID registry information to, I'll just give an example of opioid registries, for instance, being able to put that information right in the hands of a provider without them having to go look at a bunch of different systems. So you're able to connect that information in the back end and have it show up and say, hey, this is, a pharmacist can get an alert after, the system can scan, 285 data points and say, hey, this person is at risk for an opioid overdose. You may want to prescribe the drug to ensure that they do not overdose or that needs to be tracked. Same thing for any kind of monitoring and looking at behavioral health. I mean, all of these things are about trying to take all these disparate pieces of information that we collect. I'll quote Colonel Catalina at our at the Defense Health Agency Health Informatics Office. He talks about, we're not data blind, we're in a data blizzard, like we can't see, we've got to figure out how to parse all of that information and get it into meaningful ways. And so I just, it's not a single program, it is a lot of things that we are doing on a daily basis to connect that information beyond just, oh, here's an electronic health record. It's how do we use that information to improve care? And I wanted, before I moved on, I wanted to highlight one other thing too, with Dr. Evans talking a lot about connected care. I wanted to give a shout out to the VA on this. As a result of all the hard work that they have done over the years in building that foundation for connected care, the Department of Defense was able to leverage their Video Connect processes, their actual code, things that they have done to really build that video telehealth capability. We were able to leverage that during the pandemic, and we've launched enterprise-wide Video Connect capability as well, based on what the VA has done. So it's been a really fabulous partnership working through the firm and also with Dr. Evans over in the VA.